specifically the orders that make it illegal to take into account diversity, equity, and inclusion. And the order establishing that there are only two genders. These HIV clinics say they simply can't do their jobs without violating those executive orders, and that jeopardizes their federal funding. Since 1990, this clinic has established itself as a safe place for people living with HIV.
The most important thing if you're living with HIV is to remember you're going to live a long, beautiful, happy life.
CEO of Prisma Community Care, Jessica Leach, says that's in part because of federal funding for clinics like this one, connecting people to medication, which can make the condition undetectable or even prevent it altogether.
About 21% of our budget, or $3.5 million, is federal funding. And all of the federal funding we have is specific to HIV and STI treatment and prevention.
New HIV cases in Arizona grew 20% in 2022. According to the state's Department of Health Services, it's the highest growth rate since the height of the HIV/AIDS pandemic in the late 1980s. 405 of the 975 new HIV cases in the state were Hispanic patients.
My biggest concern is shutting down services like we provide means that directly is going to correlate to an increase in HIV transmission. In Maricopa County, about 7,000 people are on PrEP.
Prisma has joined 8 other clinics across the country, asking a court to block the executive orders that jeopardize their funding and declare them unconstitutional.
We cannot remove DEI, our quote-unquote gender ideology, from the work that we do.
Lawyers for Lambda Legal are not mincing words.
The president is using the hammer of the federal government to force organizations to basically get rid of their beliefs and enact the president and the executive team's viewpoint.
The lawsuit alleges the orders violate the First Amendment by limiting the free speech of nonprofit organizations.
It's sort of like tying a blindfold over a surgeon and say, cure this patient, right? These organizations need to be able to use basically scientific data and demographics in order to do the work that they do.
The White House has called DEI policies divisive and says recognizing more than two genders creates confusion. The folks at Prisma say these executive orders could have a bad impact on public health. Jamie, back to you.